Imagine this. You wake up tomorrow morning and the job you thought was secure is gone. The badge doesn't scan. The email access shuts off. The paycheck disappears. And just when you're trying to process all of that, another realization hits: your health insurance ends too. It feels like someone pulled the floor out from under you. Suddenly, every cough, every ache, every what if becomes a threat. But here's the twist. What if there was a lifeline designed for moments exactly like this? A system that lets you keep your coverage, your doctors, your prescriptions, your peace of mind without losing everything? Most people have heard the word COBRA, but almost no one actually understands it. And that misunderstanding costs Americans thousands of dollars every single year. Today, that confusion ends, because COBRA isn't just an insurance option, it's a bridge. A temporary shield built for people facing one of the most stressful transitions of their lives. Job loss, reduced hours, divorce, aging out of a parent's plan. These moments don't just shake your finances. They shake your stability. Yet hidden inside the complexity of the U.S. health insurance system is a structure that can protect you when you need protection the most. In the next few minutes, you're going to gain something most Americans never receive: total clarity on what COBRA is, how it actually works, when to use it, when to avoid it, and how to save thousands of dollars by making the right decision at the right time. By the end of this video, you won't just understand COBRA, you'll be able to navigate it with confidence. Let's start with the foundation, the truth behind who COBRA is built for and why it exists. COBRA, the Consolidated Omnibus Budget Reconciliation Act, isn't magic, and it isn't a new plan. It is simply a law that gives you the right to keep your employer as health insurance after losing your job or experiencing a major life change. But COBRA comes with conditions and a price. It's not sponsored, it's not subsidized, and it's not soft on your wallet. But the reason it exists is powerful. It keeps your coverage uninterrupted during the moments when losing coverage could be life-altering. Think about ongoing treatments, pregnancy, surgeries, or chronic conditions. You don't want to switch doctors during those moments. You don't want a gap in coverage. COBRA is the safety net designed to prevent exactly that. And now, we're going to break down everything you need to know. Your eligibility for COBRA starts with a qualifying event, a major shift in your job or family life. The most common one is losing your job, but here is what many people don't realize. It doesn't matter whether you were laid off, fired, or voluntarily quit. As long as it wasn't gross misconduct, you're still eligible. Reduced work hours also qualify. If your employer cuts your hours and you no longer meet the requirements for company health insurance, COBRA steps in. There are family-related events too: divorce, legal separation, the death of the covered employee, or a child aging out of a parent's plan. These events create a crisis where losing coverage could have devastating consequences. That's why COBRA exists. It protects continuity. The ability to keep the same doctors, the same treatments, the same prescriptions, the same medical history. No requalification, no waiting periods, no new deductibles mid-year. It matters because switching plans at the wrong time can cost more in health and money than you might expect. COBRA gives you time to make decisions, time to transition, time to breathe. And that breathing room is more valuable than most people realize. Once you lose your job or experience a qualifying event, your employer has to notify the health plan within 30 days. Then the COBRA administrator sends you an election notice. This packet isn't junk mail, it's your lifeline. When you receive it, you have 60 days to decide whether or not you want COBRA. Here's a critical detail. If you choose COBRA on day 59, your coverage retroactively activates back to the day your job-based insurance ended. That means you can go weeks without making payments and still be covered for that period. But it also means you owe the premiums for that period. COBRA coverage usually lasts 18 months. But in some cases, such as disability or a second qualifying event, it can stretch to 29 or even 36 months. And here is something most people don't know. COBRA doesn't change your plan. Everything stays identical: deductibles, networks, benefits, prescriptions. It's continuity in its purest form. Behind the scenes, you're simply taking over the full cost your employer used to help pay. That's the part that surprises most people: the cost. Because once you see the price tag, the real decision-making begins. But before we get to that, you need to understand the structure. COBRA feels expensive because your employer was likely paying 70 to 80% of your insurance premium without you realizing it. When COBRA begins, that employer contribution disappears and you're responsible for 100% of the premium, plus an administrative fee of up to 2%. That suddenly transforms a $185 per paycheck deduction into an $850 monthly bill. But here's the strategic part: expensive doesn't always mean bad. COBRA is often the best option for people in the middle of major medical treatment, cancer care, pregnancy, postoperative care, dialysis, mental health therapy, or ongoing specialty medications. Why? Because switching plans mid-treatment can cause delays, denials, or loss of access to your provider. COBRA guarantees zero disruption. No new deductibles, no new approvals, no surprises. But if you're generally healthy or rarely use medical services, COBRA may not be your smartest financial move. The high cost can drain your savings quickly. That's why understanding the alternatives is essential. Marketplace plans, short-term insurance, Medicaid, each one can save you thousands if used strategically. COBRA isn't a yes or no decision, it's a comparison decision. And that comparison is where your real power lies. This is where most Americans make their biggest mistake, choosing COBRA without comparing it to a marketplace plan. The Affordable Care Act marketplace at healthcare. GOV offers plans with subsidies based on your income. If your income drops significantly after losing your job, you may qualify for huge discounts. Some people reduce their premiums from $800 a month under COBRA to $120 a month under a marketplace silver plan. But cheaper doesn't always mean better. If you switch mid-year, your deductible resets. If you're in the middle of a major treatment, you could end up paying more out of pocket even with a subsidized plan. Marketplace plans also have network limitations. Your doctors may not accept them, or your medication might land on a higher cost tier. The smart move is simple: line up both options side by side. Compare your COBRA monthly premium, deductible status, current treatments, and preferred providers with the marketplace costs and coverage. Then decide based on your real-life situation, not fear or assumptions. COBRA is stability. Marketplace is affordability. Your job is to choose the one that protects you best over the next 12 months. There are scenarios where COBRA is unquestionably the smartest choice. If you're pregnant, in chemotherapy, recently had surgery, depend on expensive specialty drugs, or have complex medical needs, COBRA keeps your treatment seamless. If you're switching to a new job that starts insurance soon, COBRA can bridge the 1-month gap perfectly. But COBRA becomes unnecessary when you're healthy, on few medications, or able to qualify for marketplace subsidies. Many people choose COBRA out of panic and later realize they could have saved thousands. Now let's discuss strategy. The first tip: you don't need to enroll on day one. Use the 60-day window to check marketplace prices, interview new employers about their insurance start date, and calculate your deductible progress. Second, consider gap coverage. If you only need COBRA for 1 or 2 months, the cost may be worth the temporary stability. Third, if your spouse has employer insurance, evaluate the cost of joining their plan instead of assuming COBRA is your only option. Fourth, some employers offer COBRA subsidies after layoffs. Always ask. These subsidies can transform COBRA from expensive to extremely affordable. Ultimately, the smartest choice is the one that aligns with your health, your cash flow, and your next life step. And now we arrive at the moment where clarity becomes empowerment. Because COBRA isn't just about keeping your insurance, it is about keeping your stability during one of life's most uncertain chapters. Today, you learned what COBRA truly is, how it works, the costs behind it, the alternatives around it, and the strategies to use it wisely. You learned how to navigate a system most Americans find overwhelming and turned it into something you can control. Remember this: losing a job or facing a major life change doesn't mean losing your safety net. You have options, you have rights, and you have time. COBRA is a bridge, but you choose where that bridge leads. Move forward with confidence, with strategy, and with the knowledge that your health and your future deserve protection that works for you, not against you. Because in the end, the power isn't in the insurance. The power is in understanding it.